Did you know that teeth and joints have something in common? Both can deteriorate and cause pain. However, unlike teeth, joints have the ability to regenerate themselves. It is a natural process in which cartilage tissue and bones repair themselves, either in response to inflammation, injury, or even aging. So why is it that some people can move with agility as if they were young, while others feel pain and stiffness in their joints? The answer may surprise you. It's simpler than you might imagine, and that's precisely what we explore in this video. We'll explain how to restore your joint health without medication, what kind of oil can soothe damaged joints, whether bone broth really helps repair cartilage or if it's just a myth, and whether ginger can reduce inflammation. In addition, we will address whether cold or heat affects diseased joints, what we can learn from children to take care of our joints, and how to keep them healthy throughout life. To top it off, an orthopedic surgeon with more than 30 years of experience will share his knowledge about the importance of strengthening muscles when joints hurt and reveal a key secret to treating these types of problems in our new typical case section. You know what a joint is, but let me remind you how it is structured. The ends of the bones are covered by cartilage. This provides a smooth glide during movement. The joint capsule holds the synovial fluid inside and protects the joint from damage. In the event of a traumatic load, it functions as an airbag, and the fluid is a lubricant that reduces friction and protects the joint from wear and tear. With age, the cartilage wears down and the fluid becomes thinner and more viscous. This reduces mobility and causes pain, but there is a nuance. Cartilage has no nerves or blood vessels. It cannot hurt. So what hurts in your joint? The bones. You thought bones don't hurt? Inside the bones are nerve endings and pain receptors. Therefore, bone damage causes pain. For example, pain in the front of the knee is often due to softening or delamination of the cartilage, which no longer protects the bone and the bone begins to hurt. In addition, joint pain often arises from inflammation, which irritates the nerve endings in the joint capsule. In simple terms, due to inflammation, substances are released in the cells that pull the nerves of the membrane, which causes pain. Recall that inflammation is a reaction of the body to damage, but pain from inflammation can also occur outside the joint if ligaments, tendons, or muscles are affected. Why does it hurt? That is another question. The causes are numerous, from vitamin deficiency to serious pathologies. Gout, for example, also manifests as joint pain. There is a video about this on our channel. But in most cases, almost 61%, the cause of pain is wear and tear, changes and destruction of the joint. Let's talk about these joint changes and their treatment. Remember, when do your joints hurt? During movement or at rest? If it is at rest, the pain is inflammatory, and if it is in motion, it is from loading. Pain when loading the joint is a sure sign of arthritis. We will discuss this in more detail later. Inflammatory pain is another story. It arises without movement and subsides when you start moving. In the morning, usually, the joint feels stiff, but when you start moving, the pain decreases. What about you? What relieves your pain? Movement or rest? Share in the comments and tell us how you relieve joint pain. And let's compare your answers with the recommendations of the expert, doctor, traumatologist, orthopedist, myotherapist, and candidate for Doctor of Medical Sciences, Irina Gennadievna Okiritina. You can quickly get rid of the pain by killing the aching cells that scream, "Help us, please, it hurts." They can be eliminated with potent drugs, hormone blocks, and surgery. I prefer another way. Release the compressed joint, choose anti-inflammatory exercises, and focus on anti-inflammatory products. One expert is good, but two are better. Regenerative medicine physician Pavel Borisovich Ocheretin explains whether the joint can be helped without drugs. When pain appears, it is a signal, a call to action. With drugs, we can only reduce the inflammation and relieve it a little. But with exercises, we can decompress the joint and restore those tissues that today are dangerous pressures. We can stop the process of cartilage destruction. So there are a lot of exercises that help deal with pain without medication. Today, we will definitely show exercises that literally save your joints from destruction and explain how to perform them. But first, let's talk about what not to do. There are several reasons for joint problems besides natural age-related changes. These include injury, overuse, and also lack of movement and excess weight. And excess weight is the main culprit. When you're standing or walking, every extra pound puts extra pressure on your joints. Look at this. If one person weighs 70 kilos and others weigh 100 kilos, when climbing stairs, they are loading their joints with an extra 30-kilo sack of potatoes. And if at that weight you run or jump, the cartilage in the joints will suffer about the same as an egg if you hit it with a hammer. They won't take the load. Reducing weight, even by a few kilograms, already reduces the pressure and reduces wear and tear on the joints. In general, jumping, even at normal weight, always puts excessive pressure on the knees. For the joints of the arms, impacts, weightlifting, and loads with torsion, for example, when squeezing a cloth, are dangerous. Prolonged static work is harmful to the joints, no matter where they are located, i.e. staying in a stationary position for a long time. This is especially harmful when the knees are bent. If you sit in a squatting position for a few minutes, for example, next to a growing bed, you are putting a heavy load on the joints. This is not the way to do it. In fact, even when you are sitting, your knees support a quarter of your body weight. That is, if you weigh 80 kilograms, your knees experience a load of 20 kilograms. Our knees are, in general, the most vulnerable joints in the body. How can we reduce the load on them? The obvious answer is to reduce the weight, not only yours, but also the weight you carry. If you feel pain in your arm joints, avoid carrying and lifting weights. Try not to make movements that stress the joints. For example, don't squeeze clothes with your hands, don't knead dough by hand, and push the door with your shoulder instead of your outstretched arm. If your leg, knee, or hip joints hurt, avoid sudden movements, jumping, pushing, running. Wear shoes of your size with a low heel, flexible sole, and orthopedic insole. Proper footwear cushions the impact of walking, which reduces the load on the joints. When getting up from a chair or sofa, lean on the armrests, transferring part of the load to the arms. If your doctor recommends it, use a cane. Relying on the cane relieves pressure on sore leg joints. Walk, swim, and do simple exercises to the best of your ability. Daily exercise is beneficial. Movement heals joints. Wait a minute, but any activity like scrubbing the floor or working in the garden is also a strain on the joints, right? The knees bear the brunt of the daily load, followed by the hips and ankles. Perhaps on the contrary, we should move less to prevent the joints from wearing out. Unfortunately, taking care of the joints by staying on the couch is the worst decision. Why? Because it is precisely activity that activates the body to produce the lubricant needed to maintain normal joint function. In addition, during movement, blood flows to the joints, nourishing them and filling them with beneficial substances. Movement strengthens the muscles and ligaments surrounding the joints, which reduces pressure on them and improves their mobility. Physical activity does not wear out the joints, but protects them from aging. Of course, as long as the exercises are chosen correctly and do not overload you. That is why, even in cases of osteoarthritis, the clinical recommendations of the Ministry of Health indicate moderate physical activity. The joint affected by arthritis needs rest. The joint with osteoarthritis needs movement. But this usually does not involve walking. They are totally different and beneficial exercises. They are performed mainly sitting or lying down, but with a large number of repetitions. The rule of the less you touch it, the less it hurts does not always apply to joints. Of course, if the doctor has forbidden you to strain the joint, rest. But if there are no restrictions, let's get moving. And right now, we will show you exercises that save the joints and restore their mobility. Observe the correct technique of execution, and even better, do them together with the doctor. Exercises from the expert. Exercise for the right elbow joint. Extend your arm out to the side, fingers pointing up. Turn away from the right arm. Return to the starting position. With fingers facing back, twist again and return to the beginning. With fingers facing down, twist and return to the starting position. Then, shake the arm and perform the same exercise with the other arm. There is an excellent exercise for the knee joints. You will need a high and reliable table. Sit down and just swing your legs for 5 to 10 minutes. Your joints will not be loaded, but will receive an excellent blood supply. Learn from the kids. Do these exercises every day. Keep moving, and little by little your joints will return to normal. But don't forget that exercises alone are not enough. What else helps restore your joints? I'll tell you about it for sure. Stay to the end, and you will find out how to make a regenerative compress and medicated oil. But first, let's clarify how not to confuse osteoarthritis with arthritis, as they are completely different joint diseases, and the approach to their treatment, even with folk remedies, is different. If all your joints ache, what is it, arthritis or osteoarthritis? This symptom is characteristic of rheumatoid arthritis, and the curious thing is that the pain in this disease jumps from one joint to another. One day the hands hurt, another day the legs, then the elbows, the knees, and then the hands again. In addition, both hands, both feet, or both knees hurt equally at the same time. This is a sign of a disease in which your own immune system attacks healthy joints, causing inflammation and pain. Why does this happen? It is unknown. Arthritis is inflammation of the joints, which can occur at any age, whereas osteoarthritis is an age-related disease in which joint cartilage wears down. In arthritis, pain appears immediately. It is intense, sharp, and throbbing. It occurs at rest and intensifies with movement. The inflamed area becomes red and swollen. Joint pain due to osteoarthritis, on the other hand, appears after physical activity and disappears at rest. Osteoarthritis develops slowly, so the pain appears when the destruction of the joint is already clearly advanced. In arthritis, after resting, stiffness is felt in the affected joint for about 20 minutes, and then the joint seems to clear up. In osteoarthritis, on the other hand, dull pain at night is common. So which is more dangerous for the joints? Osteoarthritis or arthritis? If you ask me which is more serious, I would probably say arthritis. Inflammation can have various etiologies and is usually treated with medication. However, there are types of synovitis, inflammation, that are called reactive or responsive. For example, if you get your finger stuck in a door frame, is there going to be an inflammatory process? Yes. But would you leave your finger stuck and send a friend or your wife to the pharmacy to buy some medication to help the finger stuck in the door frame? Of course not. You would have the sense to open the door. So in this case, if it's responsive synovitis, you need to release the joint from those pressures that it's in. I listened to the expert and thought, we don't take care of our joints until the pain comes on all of a sudden. And yet, the joints warn us. They give us signals that there are problems. I will mention some symptoms that should not be ignored. In morning stiffness, think, maybe your joints also don't move well in the morning, and then gradually you wake up. This symptom indicates changes in the connective and bony tissues. The sensation that the joint is burning is another symptom. If it has also reddened and feels really hot, it means that internal inflammation has started. But if there is no redness and the joint is not hot to the touch, even if you feel a burning sensation from the inside, this may indicate osteoarthritis. The next symptom that indicates problems before pain appears is limited mobility. If suddenly your knee does not bend completely, you find it harder to hold the door key with your fingers, lift your foot to climb a step, or you feel that your movements used to be freer, this is a warning sign. What do you think if a joint moves normally but creaks and squeaks? Is it a dangerous symptom or not? Let me tell you, most people believe that the cause of squeaking, creaking, or cracking is cartilage wear and tear and lack of lubrication. And in 3 out of 10 cases, it is. Do you hear it? When there is too little synovial fluid, the joint surfaces rub together. The cartilage wears down and the creaking or crunching sound appears. But these sounds can also occur in healthy joints. When the pressure in the joint changes, the gas bubbles present in the synovial fluid burst, and this is perceived as a crackling or popping sound. This is a completely normal phenomenon, as long as there is no pain and the joint moves normally. There is another interesting symptom of a joint problem. Many people claim they can predict rain because their joints start to ache beforehand and the pain increases as a storm approaches. Interesting, isn't it? Can your joints predict the weather? Tell us in the comments. Science cannot yet offer a clear explanation for this. However, the link between joint pain and weather changes definitely exists, just like the connection between pain and cold. Have you noticed that in winter, your joints ache and bother you more than in summer? When the temperature drops, the body goes into survival mode and directs blood to the heart and lungs to keep them warm, while the hands and feet receive less blood flow. Heat is drawn away from the joints, causing pain and discomfort in the knees and hands, even in healthy people. This is because synovial fluid thickens in cold weather. Therefore, you should not expose your joints to extreme cold. But in a way, cold does help your joints. Let's consult the expert to find out when. When an injury occurs, whether it is in the joint, if you fall on your arm, or hit your head on the ice and the pain appears, the first few days are to apply cold and rest. Why do we apply ice? To stop the blood flow, and therefore stop the swelling and inflammation from starting to develop. But after a day, heat can be applied. Physiotherapeutic procedures can be done carefully if your doctor has prescribed them. At home, you can make warm compresses with sea salt. This also helps to relieve pain. Remember, cold helps relieve acute pain, but then the joints need heat to improve circulation and reduce painful sensations. And if hot water bottles used to be used for this, it is now possible to warm the joints with your own body heat. Foods are restorative and help keep joints healthy if they are the right ones. Fatty fish such as salmon, sardines, mackerel, and cod should be on your plate. These fish are rich in omega-3 fatty acids, which reduce inflammation and strengthen joints. Omega-3 fatty acids act on cartilage, those smooth surfaces in the joints that allow fluid movement. If you eat plenty of foods containing omega-3s, your cartilage will maintain its elasticity. In addition to fish, include walnuts, almonds, and flax seeds in your diet. These foods contain essential fatty acids and substances that help keep your joints from aging. On the other hand, blueberries, pomegranates, red peppers, broccoli, and spinach reduce inflammation in the joints, so they should be present on your table without fail. It is impossible to restore the joints without a sufficient amount of protein, because protein is the building material of our body. Eat meat, fish, eggs, but do not forget about vegetable sources of protein, such as beans and peas, and also prepare more often jelly or bone broth. Do you like meat broth or jelly? Like it if you do, and if not, it's time to start loving it. Beef broth contains collagen, which is very necessary for joints. Collagen is the protein that makes up our tendons, cartilage, and bones. When there is enough collagen, it cushions shock and friction in the joints. However, with age, its amount decreases, which reduces joint flexibility. Collagen-rich food helps to avoid this. In addition to beef broth, so are thickened bone broths, beef, fish, and seafood. Turmeric, ginger, garlic, and onion help reduce inflammation in the joints. They have a remarkable anti-inflammatory effect. If you consume these foods regularly, you will be tackling the problems from within. However, eating a lot of garlic every day, for example, may not be feasible for everyone. Peel 4 heads of garlic, crush it to a paste, add the juice of 10 lemons, and 2 teaspoons of grated horseradish. Let the elixir stand in the refrigerator, preferably without access to light, for 3 weeks. Then, dilute 1 teaspoon of the elixir in a glass of water and drink it in the morning and at night before meals. It's easy, isn't it? Some advise rubbing garlic on the skin, but I wouldn't risk it. This can cause a real burn. On the internet, there are many tips that are more harmful to the blood vessels than beneficial. And now our expert will reveal the most dangerous of all. There are folk remedies that actually adversely affect our joints. For example, if the joint is red, hot, and inflamed. You touch it, and it is hot, even through the jeans. You definitely should not go to the sauna. Many believe that the sauna is the solution to all problems. No, of course it isn't. When the joint is burning and you still hit it with a branch, that is strictly contraindicated. There are many joint diseases and even more methods of treatment, and they all boil down to the same thing. Stop or at least slow down the process of joint destruction to prevent the patient from ending up on the operating table. Doctors usually prescribe medication, physiotherapy, massage, and also electrotherapy, treatment with electric current. I want to tell you more about this option, as electrotherapy can not only improve the blood supply to the affected joint for its recovery, but also reduce the inflammation that is the cause of pain. To treat the joints and decrease pain, a high-frequency alternating electric field is used. This procedure can be performed at home. And now, an important point related to the recovery of the joints. Although with age, the ability of cartilage to regenerate significantly decreases, it does not disappear completely. We ourselves can not only stop the process of cartilage destruction in the joints, but also help the cartilage to regenerate with a very inexpensive remedy. I am referring to gelatin. It is the same beneficial natural protein with the water removed. It helps strengthen cartilage and connective tissues, and you only need 2 teaspoons. I share the recipe. In the evening, mix 2 teaspoons of gelatin with 1/3 of a glass of cold water and let it sit overnight. In the morning, add warm water to fill the glass and drink it on an empty stomach. That's all. Maximum simple and very beneficial. You should drink water with gelatin every morning for a month. Then, you make a month break and you can repeat. In this way, you will feed your joints with collagen. Of course, you can buy special supplements, but they are expensive, while gelatin is affordable and sold in any store. Tell us, how do you restore your joints? Share your recipes and tips in the comments. Very soon, our expert will reveal the main secret to treat joints. Watch our video until the end. And right now, we share with you the recipe of an anti-inflammatory compress and a medicinal oil for joints. In cases of arthritis, a compress of aloe vera and honey applied overnight helps relieve pain and inflammation. Mix 1/4 cup of aloe vera juice, 1/4 cup of honey, and 1/4 cup of warm water. Warm it slightly so that all the components begin to interact. Then apply the mixture to the affected joint. Cover with plastic wrap and wrap with a bandage, but not too tightly. Do these compresses every other day until the pain disappears. This remedy works, unlike the one our expert has named as the most useless. Which remedy is it? Attention to the screen. The most useless folk remedy is to listen to the advice of neighbors. What helps one person may seriously harm another. Don't wear other people's clothes. Another popular method of treating sore joints is rubbing red bell pepper oil. Red bell pepper has an excellent warming effect. No wonder many pharmacy drugs for joints are made on the basis of this ingredient. The fact is that red bell pepper contains capsaicin, a substance which firstly blocks pain signals, acting as an analgesic. And secondly, it stimulates blood circulation. Blood flows to the affected joint, which reduces inflammation. That is why red bell pepper oil is used to relieve rheumatic joint pain. It is an excellent alternative to pharmacy drugs, and you can prepare it at home. Take 10 fresh red bell pepper pods, wash them, and grind them with a meat grinder. Add 2 cups of vegetable oil. It can be any oil you prefer. Place the mixture in a dark place to rest for a week. Then strain it and use the oil for rubbing at times of exacerbation of joint problems. But remember, you should not do this if you have a fever, when they are free. If a person is being hanged by the neck, they will suffocate. If a person is being strangled but is also offered to drink some water or wear an oxygen mask, that is also foolish. If the joint is compressed, it will be destroyed. Joints recover when they receive nutrients. In addition, the condition of the joints can be improved with the help of honey and apple cider vinegar. The fact is that apple cider vinegar contains acetic acid, which is known for its anti-inflammatory properties, and it is inflammation that causes rheumatic diseases of the joints. And honey contains calcium, magnesium, and potassium, which are essential for joint health. But it is important that the honey is authentic and quality. Mix honey and apple cider vinegar in equal proportions and take a teaspoon of this mixture in the morning and evening. Dull joint pain is relieved with warm sea salt baths. The heat relaxes the muscles around the joints, relieves tension and spasms, which intensify joint pain. In addition, the blood vessels dilate, allowing more blood to reach the painful joint, along with oxygen and nutrients. As for sea salt, it has anti-inflammatory properties. By immersing yourself in sea salt water, beneficial minerals penetrate through the skin and help reduce joint inflammation. And now the time has come to reveal the main secret to treating joints. Watch and listen to the orthopedic doctor with over 30 years of experience. There is one disease that I deal with in practice every day: deforming osteoarthritis. Osteoarthritis is multi-stage joint destruction. If we look at a healthy joint, we see 2 articulating bones that are covered by a slippery, moist, elastic hyaline cartilage. And then this cartilage starts to degrade, becomes dry, brittle, and cracks. It then undergoes destruction, erosions appear, and later, the bone itself begins to collapse. You may have noticed that the legs become crooked in the shape of an O or X. Why does this disease arise? Many years ago, I used to say, well, it's a multifactorial process. No one knows why it is being studied. Nutrition, weight, and genetics are culprits, and so on and so forth. Yes, those aspects I mentioned play a role, but if you start looking at the essence, you see that first and foremost, the joint is caught in a muscle trap. There are many muscles in the human body, 696, but there are some that work more than others. Some people remain in the same static position when they should change it every 15 minutes, and others are in motion. Repetitive work leads to the formation of stiffness in the muscles. If a muscle is normally elastic and homogeneous, knots, stiffening, and so-called trigger points, which are muscle calluses, already appear here. Due to the trigger, the muscle becomes inhomogeneous. This causes reflex pain. The cause of the pain, for example, can be in the gluteal region, but it hurts the knee joint and the person limps. And if it is a muscle that squeezes the knee joint, that is, it is located in the periarticular tissues, then the knee joint will be compressed 24 hours a day. And over time, it will not resist and will begin to lose cartilage moisture. It will dehydrate and then begin to resist and produce more lubricant. Some will have a Baker's cyst, some will have synovitis, some will have bursitis. This is a protection of the compressed knee joint from destruction. Then the joint becomes depleted, its reserve of strength runs out, active destruction of the cartilage and then of the underlying bone tissue occurs. Therefore, my colleagues and I locate the trigger points and treat them specifically. There are no drugs that cure osteoarthritis. Having worked as an orthopedist for quite some time, with 39 years of medical experience, I have become convinced that there are no drugs that stop osteoarthritis, let alone reverse it. But released cells, as opposed to trapped cells, have a completely different perspective. That's right. It turns out that treating osteoarthritis requires freeing the joint from the shell of tight muscles. How to do that? That's another question to answer together with an orthopedist, as the trigger points, i.e., the places where the muscle is tight, are different for everyone. Free your joints from tension. Live actively, but don't overload your joints. Find the balance between activity and rest. And remember that your joints are the key to an active and fulfilling life. Follow our simple tips, and you can enjoy movement without pain or discomfort for many years to come. At almost 62, I move much better than I did at 30. I bend more, my body has become more flexible, I have no pain anywhere, unlike when I was in my early 30s. What does it take? To eliminate all the blockages that prevent our body from living well, to change our diet, and to maintain proper hydration. You can move at 80 as well as at 30. In our country, there is a stereotype in which doctors say, "What do you want?" It is the age. Or what do you want? It's weight. I always tell my patients that the problem is not in the amount or mass of fat tissue, nor in the age. The problem is in the quality of the connective tissue. Why does Oriental medicine care about the flexibility of the spine at any age of the patient? Because they understand that the spine is the pillar of life. Oriental medicine will never attribute your situation to your age or your weight. They strive for flexibility of the spine at any age of the patient. That is what I wish for all of you. And if you want to know more about how to maintain joint health and much more, give this video a like and subscribe to our channel so you won't miss out on expert advice and effective recipes for your wellness, health, and longevity for you.